Hello, everyone. My name is Virginia Hunter, and I am looking forward to working with everyone in this class and completing my practicum. I have been a nurse for the past 25 years. My first 2 years as a nurse was spent on a post-op medical surgical unit. However, for the past 23 years, I have worked in my local hospital's Women's Center unit. The first 16 of those was as a staff nurse, and the past 7 have been as the nurse manager of that unit. All of my nurses are cross-trained to take care of antepartum, postpartum, intrapartum, nursery, GYN, and med-surg overflow patients. On a personal note, I've been married for the past 31 years, and I have 2 grown sons. My oldest son is also a student at UNCW. My husband and I also have an 8-year-old yellow lab named Zeus. My father is also staying with me due to the Hurricane Florence. His house was flooded and is no longer livable, so he has become a member of my household. As you can probably guess, my focus for this practicum will be on women's health. The educational project that I plan to work on is going to be the implementation of a LARC or long-acting reversible contraceptive program on my unit for our postpartum patients. The ultimate goal is to reduce maternal and neonatal mortality and to improve birth outcomes through the reduction in unintended pregnancies. In North Carolina, over 50% of pregnancies are unplanned. 80% of teen pregnancies are unplanned. Unintended or closely spaced pregnancies has an increased risk of adverse birth outcomes. In 2015, the perinatal region that includes my hospital had 166 infant mortalities, 1,683 low birth weight deliveries, and 2,178 preterm or less than 36 weeks deliveries. Evidence has shown that the LARC program is the most effective form of birth control, and this is supported by ACOG. My objectives will be to develop a process for insertion of LARCs with providers and nurses. This will include building clinical support for postpartum insertion of LARCs, developing counseling consents and insertion procedures, and developing a process for incorporating LARCs in the delivery room or postpartum period. This will also include training of all clinical staff to include OB providers and nurses. I will also develop a policy and procedures to include pharmacy and billing departments. Thank you.